morning, Linda. How you doing?
Good morning. I'm fabulous. Thank you.
Well, good. It's great to see you again. It's been a while now.
Yeah, not well. You put me back in good shape, so I don't have any reason to see a doctor unless I get a cold.
Well, we stem cell wise, we had done some work, a long time ago, but last summer we addressed your low back and your shoulder and a knee and a hip. And then boosted that shortly thereafter. I think that was in June of this past year. So it's been about 9 months, huh?
Gosh, has it been that already? It's gone by so fast. Yeah, I guess that's why I'm pretty much, touring Africa and, hiking with gorillas because I'm like pain. I feel like a new person. I truly do. I feel like I can't testify enough to people that, the back pain I was feeling was so extreme. I would do hardly anything, and this lower back would go out. And the last time it went out, they took me out of the house in an ambulance. I said to Steve, my husband, I said, I'm really concerned that I'm gonna be on a walker soon if we can't figure out what to do with this. And in Mayo, they're as good as they are. They're like, except for surgery, you just take pain medication, do physical therapy, and that wasn't cutting it. First of all, I don't want to take pain medication. I wanted to figure out how to get my back in shape. So, I just decided to Steve, I said, listen, every time, this started almost 10 years ago between you and I. And
Right.
When I lived in Colorado and my knee, I had hereditary arthritis in my left knee, like a lot of my other family members, and I couldn't hike those wonderful mountains up there. And at nighttime, you'd feel a little pain during the day, but you feel extreme pain at night.
I think we did a combination of things eventually, going back a long time. And then
Correct.
There was a big lag in time before you reached out again.
Yeah. It was like almost eight years at least. I remember my years, but that was incredible because that just, when they took an X-ray, it was almost close to bone on bone, and then when they took an X-ray, like a year later, it had wonderful cartilage in there, and I'd been pain-free and hiked, as if I never even had a problem.
That's great.
So, yeah, and then that moved on to, my shoulders and my hips, and because I have bad rotator cuffs and torn some tendons in the rotator cuff area. And so I just figured, first I reached out for my back and figured I might as well get it all done, one-stop shop. And but truly I think that everything has really put me back in the game. When I thought I was aging much quicker, I felt like my body was aging much quicker than I was aging, and I had no alternatives. But stem cell has truly just been nothing short of a miracle.
That's great. Tell us about how long after, I initially saw you in June of 22, did you start to what was the progress of how you started to feel better and were able to get back to activity?
So the first part was in June. So, it was almost within 4 weeks. So, probably I'd say 3 to 4 weeks that I started to do stretching, and then I started to do a little bit of getting back to the gym,
Right.
And doing my arm exercises and things like that, where I couldn't even go to the gym before because I was petrified my back was going to, go out. And then from there, we started hiking. So I started with low impact hiking, about a mile, and then it immediately increased to 2 miles to strenuous hiking. And then within, I think 6 weeks, I said, I'm feeling good. I'm not going to push myself, but I'm going to start biking. And, I'd actually forgot about, my back because I was doing everything I normally did. I was hiking and biking, and I didn't even feel, it felt like a miracle because I didn't feel like I had ever had a back problem before.
Right. And just so people know, we treated 2 discs. We treated the disc at L3-4 and at L4-5 at that time. And both degenerative, but not enormous herniations, and perfect candidates for a procedure like this.
Well, the interesting thing is that it wasn't a big disc problem, but when it went out, it pushed on nerves, so it made it difficult for me to go to the bathroom. I'm truly a new person. And then we had the follow-up procedure, which I was kind of hesitant on doing because it was like, I feel so perfect. Why mess with good things?
Well, you just got back from a big trip. You've certainly given it a good test, huh?
Oh yeah, we trekked with the gorillas in Africa, and you trek, about an hour to 2 hours into a high bushwhacking area, and you hang out with the gorillas for an hour, and then you trek back down. It can be tricky with bushwhacking and a little bit of rain in the rainforest and stuff like that. But I've had, knock on wood, I've had no problem. My knees are fine, my hips fine, my back is fine.
Great.
I'm 64 and I'm put back together. So I get very upset when I tell a lot of people, call Dr. Brandt, and they're like, well, I don't know. I'm like, you'll be out of pain. If you're at a loss, you got nothing else to do, you'll be out of pain.
As far as you're working with the office and working with the staff here, you just describe that a little bit.
I think the part that made me feel the most comfortable was the true explanation of how the procedure was going to go every step of the way. Here's the process, and here's what's going to take place before, here's what's going to take place during, here's what's going to take place after. And it gives you such a comfort level that there's no surprises. I mean, years ago when we first did it, I was awake during the procedure, which was easy too,
Right.
And now I think the procedure is advanced to where when you're doing as many joints as you had to do on me, you opt, I guess, in some cases to,
Yeah, to use IV sedation. It's and it's a nice way to do these procedures. They never need to be done under a general anesthetic, but having the option to use an IV sedative, whether that be very light or deeper for some people that have fears of being awake during a procedure, we have the option either way. And especially with you this time, we did do a number of areas, and it was a longer procedure, and most patients just feel more comfortable, having some sedation when it's going to be the additional, it's one thing if it's one knee, it's another thing when it's multiple areas over several hours.
Yeah, and then the assistant that sees you before the procedure, that gets you ready, the bedside manner is so comforting. They'll make jokes with you, they'll talk to you, they'll ease your mind, and and then they move you pretty quickly into the room, and next thing you know, it's over and you're going home and you're trying to decide where to have lunch.
I'm so glad that you're doing well, and it's always a pleasure to see you. And as always, you can always reach out to us if you need something.
I have to say that the interesting thing is that Mayo Clinic does PRP, and I've actually talked to my doctors when they said, listen, this is working, it's a good thing, he's a good doctor, we know who he is. We recommend that you not get, because all we can do here, we haven't advanced that far, is PRP, that we recommend that you go back to Dr. Brandt and, take care of your back or take care of your shoulder. So.
Well, that is definitely a referral worth having. It's always nice when the Mayo sings your praises. I really appreciate you doing this. It's really helpful for patients to be able to hear from real patients, and there's nothing better for a patient to hear than the experience of a patient that's gone through it more than once over time, over a long period.
Thanks, Scott.